Okay. Hi, everyone, and welcome to our Living with MCI and Dementia webinar series. We're really excited to bring to you today a couple of our own. Katie Lyles and Jenny Gay will be talking about the Savvy Caregiver program, which is one of the crown jewels. Just a couple of housekeeping notes. We do hold our webinar the second Wednesday of each month at noon. And if you've missed some, they are available recordings on our YouTube channel. If there's a topic that you haven't heard but you would like us to cover, please do let us know. And on that note, our chat will be disabled today because we're in a webinar format. So we ask that you use the Q&A. And if you have questions, please don't wait until the end to enter them. We want to make sure that you capture them when they occur to you, but we will be answering questions at the end. And without further ado, I would like to introduce our speakers. Katie Lyles serves as the Senior Program Coordinator for the Service Corps at Georgia MemoryNet. She plays a pivotal role in training community service educators statewide, and this training focuses on equipping the educators with skills to assist patients and care partners in navigating the complexities of memory impairments. She has over 15 years of experience as an occupational therapist, and she has really dedicated her career to enhancing individuals' overall independence and quality of life. She is a Savvy Caregiver facilitator at the Georgia MemoryNet, and she is driven by a deep passion for empowering people to live their life to the fullest at every stage. We are also going to hear from Jenny Gay. She is the clinical social worker for the Emory Integrated Memory Care Center. She has been practicing social work with elders and people living with dementia for 15 years herself. She received her bachelor's degree in social work from Warren Wilson College and her master's in social work from Tulane University. She is passionate about supporting people living with dementia and their care partners, and we encourage you to learn more about the IMC as well. So, Katie, if you want to go ahead and share your PowerPoint.
Sounds good. Thank you so much for the introduction. I'm honored to be here today. Okay. Can everybody see my screen? Very good. Okay, so we're going to be talking about the Savvy Caregiver program today in two different kind of delivery formats. So a lot of the content is the same. The Savvy Caregiver program has been around for over 20 years. It's evidence-based, and it was developed by a team of psychologists, social workers, and an occupational therapist. So it has a really great holistic approach. So what exactly is the Savvy Caregiver program? It is a training program for caregivers that really focuses on helping them to develop a great toolkit that they can use throughout the disease process. So it is not a support group, although we know that support groups are very valuable and have their place. I do like too that it's very caregiver focused. So it's not, just how to care for the person. It's also taking care of the It starts out with a great basis for learning about different types of dementia and how it affects the person, and goes through different ways to manage the day-to-day activities as the caregiver, and then trying to foster a more positive and powerful attitude. So the program that we do, the traditional Savvy Caregiver program, is 6 weeks long. So I'm going to go through kind of the different topics that we include each week. So this first week looks at the caregiver's role. We go through a few different types of dementia and then examine how that really affects a person's thinking, and then start considering different ways that the caregiver can, modify their approach based on, this progressive disease. One of the things that I really like is that with dementia, it's not just the memory that's impaired, it's all areas of cognition. And as these areas are affected, it really causes confusion and chaos in that person's world. So trying to understand where they're coming from gives us a good idea as to how to help shift the way that we're doing things to improve their quality of life, as well as the quality of life for the care partner. So in that first week, we look at different ways to communicate with our person to help make things better. So, for instance, instead of saying we're going to your brother's for dinner on Thursday, our person's not able to remember, when Thursday is, and they may not be aware of the time of day that they're in. And that can lead to lots of repetitive questioning, which can be quite frustrating for the care partner. So the suggestion is to wait until Thursday to talk about going to dinner at the brother's house. And there's a few other suggestions here. So instead of going through the reasoning process as far as if we can have hamburger tonight, I won't have to go to the store until the weekend. You can say to your person, we're having hamburger tonight. So we will move on to week 2. Week 2 really focuses on the importance of caregiver self-care. And this is an underlying theme throughout the rest of the program. And it helps the care partner to shift their attitude about caregiving from negative and powerless into a more positive and powerful mindset. And then we also learn about how these challenging behaviors that care partners typically see are the result of some sort of confusion. The focus on caregiver self-care really stems from some facts that we have about caregivers, and especially for caregivers of a person living with dementia, are twice as likely to have physical or emotional health issues. They're more than twice as likely to use depression and anxiety medicine. They're at a higher risk of social isolation and or economic distress. They're only half as likely to use healthcare. They're more likely to have a weakened immune system, and also more likely to experience family conflict really related to this. And understanding that really helps us to take into consideration how important it is for us to take care of ourselves as the care partner, caregiver, situation. It's a progressive disease, and it can range anywhere from 8 to 20 years, but you really don't know. So taking care of yourself will help to make the journey, better both for you and the person you're caring for. But also, without taking care of yourself, you're not able to take care of your person. So again, it kind of goes through this idea that when our person is experiencing confusion, it actually causes them some discomfort. And that's where we see these challenging behaviors come in. And a lot of times it's these challenging behaviors that lead to placement in a facility when the caregiver just can't deal with this anymore. So the Savvy really helps you to identify the source of that confusion so that you can try to help prevent it in the future. So in week 3, we start talking a lot about this idea of contented involvement. And then we also learn more about the stages of dementia and what to expect at each stage. And this idea of contented involvement is just that each person retains a piece of them even throughout the disease process, and they have the ability to participate in tasks and be content in doing them. So it's finding ways that we can modify either our approach or the environment or the way that things are presented to allow them to have this contented involvement. So in week 4, we're learning more about how to fit tasks for our person based on their stage. And we're using the idea of fit to help create this contented involvement. So these different anchors of contented involvement it's going to be kind of 3 parts. So we're looking at the person, and, like I said, part of that person will persist throughout the disease process. So their likes, their dislikes. And then we look at the structure of the task. So as far as how are we setting it up for them? Is it, do they need a quiet environment? Do they respond better if there's some soft music playing in the background? Do we need to have them, with no distractions in front of them? And do we need to kind of provide one step at a time? And then we look at the support, and that's, are we going to be verbally telling them what to do? Do we need to show them what we're doing? Do we need to just provide a little, physical touch to help guide them to get started? What kinds of encouragement are we providing throughout the task so that they can be successful at what they're doing? And then from here, we really work on further, fitting that task to facilitate the contented involvement. And we look at different models for decision making. I love this because all of this idea of helping to facilitate the contented involvement is kind of at the heart of occupational therapy, but it's very, person-centered and looks at the whole situation. So looking at different types of support, and we can think about it from, on that left side, we can provide more of that abstract assistance, and this would be more appropriate in the earlier stages. And then as the disease progresses, we're going to need to provide more and more concrete support. So, earlier in the disease stages, we can maybe provide written instructions on what they need to do, or maybe we can give them multi-step directions and they can, complete all of those things, or we can just give them a little reminder as to what they need to do. But, as that disease progresses, we're going to need to use more simple instructions. We may want to kind of demonstrate the things that we want them to do as we're, telling them, or we may want to point to different things. And then finally, in the later stages, it's going to be more of that physical touch. So you're going to, show them, physically guide them through what you're doing, or handing them something one at a time. So, doing more one-step directions, not doing the verbal. So you're handing them or starting their hand where they need to go. And then finally, in that 6th week, we are developing resources for our families, our caregivers, to know what it is that they can rely on, so that they are not solely responsible for every aspect of caregiving. And then just reviewing the main ideas of the program. We really talk a lot about improving the resources that you're using of your family, and that family is your family of choice. So it's not necessarily the nuclear family that you were born into. It's all the different resources that are available to you. And this can also include, outside sources like community programs or paid caregivers to help support you. And our goal is to really understand how our family actually manages to work together, and then how we might be able to realistically and effectively involve them in this caregiving guide. One of the things it talks about that I think is really interesting is the idea of having a menu and recipes for how others can help you. So you have a list of the things that you need assistance with as a caregiver. And that can be, personally, whatever you need. Maybe you need someone to come and cut the grass. Maybe you would benefit from someone, cleaning your house for you. Maybe you need someone to do some meal prep or go to the grocery store. Or if it's just to sit with your person for a few hours so that you can, go to your own doctor's appointment, maybe do something that you enjoy doing, like go get a, pedicure, whatever that might be. Having a list of things available so that when someone says, hey, if you ever need help, I'm here, you can say, hey, it would be great if you could maybe come and sit with my husband for a few hours on this day, because I have an appointment. And then the recipe aspect of that is teaching that person how they can interact effectively with your person so that they feel comfortable and more confident. So how can the caregiver sign up? So Georgia MemoryNet is able to provide the Savvy Caregiver program for free to any caregivers who are living in the state of Georgia. So our program takes place through Zoom, so similar format to this. The program is 6 weeks long and it's 2 hours each week. We do the same day and time each week. So it is a time investment, but it's, in my opinion, very valuable. We have an interest form here that you can fill out. And from there, I'll send you an email about our upcoming classes. And you can choose the one that fits your schedule best. And we go from there. We've got, for this program, we have 3 facilitators, and we generally do about 10 to 12 classes each year, and at different days and times. So we try to give different options, work out with other people's schedules. All right, so what are the requirements in order to take the Savvy Caregiver program through Georgia MemoryNet? And we want caregivers who are caring for someone in early, middle, or late stages of dementia. You do have to have internet access and an electronic device, since it is all through Zoom, and must be able to devote 2 hours per week for those 6 weeks. So the program builds on itself, and we keep our classes small to somewhere between 8 to 12 participants. And everyone really, kind of develops a lot of their, you're sharing things about what's going on in your life. The relationships really build on each other. So we keep you in the same class, and we don't record anything. So if you miss a class, unfortunately, you can read through the material in the manual, but we can't make it up. But it's for caregivers that want to enhance their skills. Now we will shift over to the Tele program. So I'm going to hand it over to Jenny.
Thanks so much, Katie. You did a beautiful job explaining all of that, and I really appreciate all your work putting that together and what y'all do at Georgia MemoryNet. So I'm going to be speaking about the Tele program, which is the version of Savvy that we provide here at Integrated Memory Care for our patients' caregivers. And again, those caregivers are not always part of someone's nuclear family. Sometimes it's a close friend. Sometimes it is a distant relative. Sometimes it's a church member. So we try to be flexible enough to accommodate whoever is identified as the primary caregiver or part of the caregiving team for someone. So Telesavvy is a completely virtual program. It was an offshoot of Savvy. And the idea was that the Savvy program, before it was offered virtually, this was the virtual option. So the reason we're not going through the entire rigmarole of each week for Telesavvy is because it really mirrors exactly what Katie shared. So it's very similar. It's just a completely virtual platform. And so that's what we'll be talking about. And I'll give you more bits and pieces as we move through. So For the Tele program, the overall objectives, the class is completely focused on the caregiver. This is a class, like Katie shared, to help people learn how to better care for themselves while they're caring for someone living with this disease. And it's also to help them hone their communication and approach to working with their loved one so that they can have more successful experiences and help manage those behaviors in a more sustainable way to hopefully help that person remain in the environment of their choice. So we're helping caregivers appreciate how impactful their work is as a caregiver. I'm in the midst of teaching a Tele session right now, and some feedback that I got immediately after our first session was, I never realized that I was the CEO of my loved one's care. I am doing all of these roles. And I think the class overall provides a lot of validation for our caregivers, because it's so important for them to feel validation and encouragement and support and know that they're doing so many things and doing them well. Reducing the potential adverse impacts of caregiving. So, I think that overall is helping to reduce caregiver burnout, helping to prevent people from having health issues that are directly related to the stress from being a caregiver or the lack of ability to care for self while you're caring for someone else. Increase a caregiver's skills and knowledge for caregiving, helping caregivers, I would say, embrace a more strategic outlook on their work and really view what they're doing for their person more objectively and more clinically to help them be more skilled in that care. Helping caregivers develop more effective strategies for caregiving, improving self-care skills. So there are really concrete tools within Savvy and Tele to help people think about how they want to implement self-care, whether it's, there's some actual exercises that are built in that are like breathing exercises, meditation, or also thinking outside of what's in the class and thinking about whether it's going to take a yoga class or taking a walk outside, or like Katie said, getting a pedicure, whatever that self-care means for you. It's helping people really understand what self-care is versus just spending time away from their person or time alone. It's really how to be intentional with that time, which I think is important. And I've learned a lot about it too. Improving the quality of life for care recipients. I think when our people feel good, we as caregivers can feel better. And so enhancing that quality of life makes things better all around for everybody. Increasing involvement of other family members and resources. So often caregivers get in a pretty isolated space and really struggle to reach out to others to help them and really build what we call our caregiving village. And so even if it's letting somebody come mow your grass or go grocery shopping for you or sit with your loved one 2 hours a week at the same day and time, knowing that you have that time for your space or have that time and space for yourself is really valuable. So technically the content of the course is delivered in 6 2-hour weekly sessions, but there is an additional session with Tele. So it is technically 7 weeks. The first session is about how to use the Zoom platform, the materials that come with the class, and just kind of an overview. And we do introductions in that as well. But so it is 7 weeks for 6 weeks. Sorry, Katie, can I have the next slide? This is a breakdown visual of how the Tele program works. I'm very visual, so I love this. So there's a group video conference once a week, and we are talking and going through the exercises and doing a check-in. I think the check-in is really valuable. It's really where it's not a support group, but it's a place for the caregivers to have that support and coming together prior to jumping in to feel like they're part of this experience with these other caregivers. And often in some of my classes, the people that participate, if they feel comfortable, will share their emails with each other and we'll start a Zoom support group after the class happens or stay in touch with each other. So it's a really good way for them to have that touch point and to build some relationships in a way that's not a support group. So it's coming together 2 hours each week, doing content check-in, and then There are a manual and a journal and a workbook that come with the course. And so there is work outside of class that is tied in directly to the curriculum. So each day with TeleSavvy, you receive a video lesson and it comes to you via email through a platform that you're registered with through Emory School of Nursing. And so you get that video, you watch that video. You are not sent a video on the video conference day because that would be too much. So it's 6 videos a week. And then through those, you're being prompted with reading, homework, and assignments. And then we come back together after each week of those things happening. And again, we're checking in, reviewing content. We're going through the various exercises, fielding questions. So, you know, I think I try really, really hard to give all participants participating in TeleSavvy a lot of grace because I know that most of them are full-time caregivers for their loved ones. So sometimes they have to miss a session. Sometimes they may just have to join by audio and not be able to engage in video. We don't want this course to be an additional stressor for any of our people. They have enough on their plate. So again, we can't record the sessions because of HIPAA, but I try to be flexible in that if you have to miss a session, it's okay. But I always tell people the more you're able to join and do outside of class, the more you'll get out of it. So these are the lovely faces that the TeleSavvy participants get to see in the videos that get pushed out. So each week it's a different combination of these awesome speakers. And I have to just give a shout out for IMC's very own Dr. Carolyn Clevenger, who was a big part of creating this course and is our clinical director and founder at IMC. So these are the people that are going to be providing videos that get pushed out. And so it's an interdisciplinary team that covers the content and assignments and offers these really effective and really helpful vignettes in these videos to help people better understand how to improve their skills as a caregiver. So right now, we are able to offer TeleSavvy twice a year. I hope that we may be able to increase that as our team continues to grow. But right now, that is all that I am able to do as our social worker here. It is available to any caregiver supporting a loved one currently enrolled in our care. And that is with IMC, that's either in our in-clinic program or in our community-based program. It is open to all of those enrolled in our programs. Enrollment for the course is announced in our weekly IMC caregiver newsletter. So under educational offerings, I will put a post and I will provide my email address and people are able to sign up that way. I usually start recruiting about 2 months before class. So if you are an IMC caregiver and for any reason you're not receiving our newsletter, please let us know so that we can make sure we fix that and get your email on that list. All materials and content related to the course are electronic, so they're downloadable PDFs that are sent to you. And I have caregivers, some that choose to print it out because they want to put it in a binder, and that's totally fine. I just can't print that out for everybody individually. And I am facilitating the course for TeleSavvy through IMC. So, and that's me. I'm Jenny Gay, our social worker. And so that's all I got. But we hope that for those of you that haven't participated in this training, you'll consider it. It is a really, really impactful, wonderful course that makes a big difference for a lot of people.
Jenny, thank you so much. That was fantastic. Katie, you did a wonderful job. We have one question in the Q&A. If others have questions, can we invite someone that will be helping the main caregiver? Absolutely. For the offerings from Georgia Memory Net, anybody is welcome. Basically the way the funding works is that anybody that is helping somebody with dementia that lives in Georgia, the person with dementia lives in Georgia, is welcome to join, and we've had individuals join from Europe. We've had individuals join from the West Coast. We have to work on the time changes and so forth, but it's a great program, and it's really quite a boon that we are able to offer it at no cost through the grants that we have. I had a question just to kind of reiterate, Jenny. Telesavvy is available to care partners of individuals that are part of the integrated memory clinic, right?
Yes, and it's our in-clinic model and our community-based model. And we have had some professional caregivers that are supporting families, whether they're private or through an agency. I have had caregivers participate in class before. So we try to be as open and as flexible as possible. Our goal is not to put barriers in place to not have people come. So at least ask before assuming one way or the other.
So Telesavvy is another perk of the IMC. And if you are not part of the IMC, then the Georgia MemoryNet offering is available to you. Another question, when is the next session of Telesavvy projected to begin?
I'm in the midst of doing a session now. Next week will be our third week. So our next session will be in 2025, and it will be towards the beginning of the year.
Georgia MemoryNet website to register for the course. So I sent out the information, the link in the chat. So everybody should have found it in the chat. Unfortunately, I can't add it here to questions and answers, but it is in the chat. And you can fill out that interest form and you'll get a call back from us, one of us. You can also, if you're part of the Emory Cognitive Neurology Clinic, not the IMC, but the Cognitive Neurology Clinic, you can let your nurse practitioner or your social worker know that you're interested in the program. And we'll get you on the wait list.
And for Telesavvy, if you're a caregiver through the IMC and you have an interest in doing the Telesavvy course for the next session, I always start rosters for the next session. So it's okay to reach out now to me via email if you are interested and want to participate in our next offering.
Any other questions?
About how large are these classes? How many people can you serve each time around?
Katie, you want to field that?
Yeah. So the courses that we do, we keep the classes to between 8 to 12 caregivers. That way, because each week is very interactive. We're, sharing what did we do for self-care this week? What things did you try with your person? What worked? What was more of a learning opportunity? We've also had people come in and just say, I can't get this to work. Does anybody have any suggestions? And we've been able to kind of work through some difficult situations that they've been having, or, at least just share some ideas and everybody feels validated in, the fact that they're not going through this alone.
For Telesavvy, I will say I'm probably facilitating the largest course that I have, and that is because sometimes when we enroll people, after the first session, they realize it's too much of a commitment or it's something that they're not able to do. So, it just so happened, luckily, that this time around, everyone seems to be sticking with the class, which is awesome and amazing. It's a great group of people. And so this is a larger class. It's about 13 people. But I probably wouldn't go over 12 typically.
Ideally.
I've never had this problem before, and it's really not a problem. It's a wonderful thing. I'm so happy to have folks interested and engaged. But I can also do it with a group of 2 to 3, which I've done multiple times.
Okay, very good.
But the hope is at least 12.
Very good.
Good.
Any other questions? All
Jenny,
right.
I was going to see, Jenny, if you wouldn't mind sharing just a little bit about the IMC. I think it's such an awesome program.
Absolutely.
Okay.
I would love to. So I am so honored to be part of this clinic and the work that we get to do every day. It is literally my dream job. The Integrated Memory Care Clinic is primary care for people with a diagnosis of dementia. So we assume responsibility for someone's complete primary care. So if someone moves through the disease process, we're meeting them where they're at, and we're also looking at and treating their other comorbidities. But we're an interdisciplinary team. So we have myself, I'm a social worker. We have a team of nurse practitioners. We are nurse practitioner led. So your primary care provider here at clinic would be a nurse practitioner. We have 2 Geri Psych nurse practitioners on our team, geriatric psychiatric nurse practitioners, who are able to really support our nurse practitioners with our patients with more challenging psychiatric symptoms as a part of their dementia disease process. And so people are able to meet with myself to have access to our Geri Psych providers. They have their nurse practitioner. All of our nurse practitioners are they're really like unicorns in the healthcare system. They care so much and go above and beyond to deliver excellent care to our families, and they really, really care. We also have a team of nurses that does all of our triage through the MyChart portal, and provide a ton of support for our people, not just clinical questions, but also a lot of emotional support. We have an awesome admin team that makes things run a lot smoother for us. And about, I think it was like probably June of 2023, we launched the community program. So what I just described was our clinic program, where people are coming into our clinic to receive care. But we launched the community-based IMC program about 1.5 years ago, and that is taking place in various assisted livings and memory care communities throughout the metro area, and is a really excellent comprehensive program that people pay a monthly fee for. They receive a weekly visit from a dementia care assistant who we have an awesome team of folks who follow an engagement plan that's been created by an occupational therapist and our nurse practitioner who is working with that patient. Our nurse practitioner is providing all of that person's primary care visits in place in the assisted living and memory care communities. And those folks also have access to all of the other services at clinic, including myself, our nursing team, and our Geri Psych providers. So it's a great program. And on our website, there is a list of where we are active in those communities, and we are actively recruiting for new folks in those communities to become a part of our program. And we are going to be moving, hopefully by the end of the month, we're moving across the street to 57 Executive Park on the first floor. We are going to be in a beautiful space that I think will be really special for our team and also for those that are coming in to receive their care. It's a pretty incredible space. So don't think I've missed anything. The one other thing I'll say is that we have a direct phone line. We do not use the Emory call center. So we have a direct phone line, and our nurse practitioners staff an after hours phone line. So if you call after hours to try to make a critical decision about an infection, a hospital, any of those things, you're going to get on the phone with one of our nurse practitioners, and they are going to help you figure that out. So we provide that support directly just from our team, and that's pretty unique in the Emory system. So we try to eliminate those access barriers. Thank you for giving me an opportunity to talk about IMC.
Thank you. It's such an awesome program. And I saw, I think it was Carolyn speak last year, and she was saying that, you know, based off the research that you're doing, that y'all have been able to cut down on people going to the hospitals by like 50%, which is incredible. So really great work. Thank you for all you do. Yeah.
Thank you.
There's a question, Jenny, about is there a cost for either program? I'm not sure if that refers to Tele and Savvy Caregiver Currently, we're able to offer both of those under a grant, so there's no cost for either of those programs.
Yeah.
You may also want to speak to the requirements to be part of the clinic.
Yes.
And maybe if there's the cost associated with the community program.
Yes. So in order to become a patient here in clinic or in the community program, you have to have a diagnosis of dementia. And you have to go through a little bit of an intake process with us to make sure you're appropriate for clinic. We really, it's pretty important that the person is living somewhat inside the metro area, and definitely in the state. We can't, none of our providers can prescribe outside of the state. So it's very important that you're in state. And we used to have kind of a radius. I think that we try to be more open-ended about it now. Our rule of thumb was kind of 25 miles from clinic. But again, some of our communities are that distance. So I think it's worth reaching out and talking to our admin team to see if geography is a challenge or a barrier. For our community program, there is a monthly fee. I believe that fee right now is $400. And it has changed a few times as we are developing the program and launching it, but I believe right now that is the monthly fee, and that covers all of the care coming to your loved one in the community, the weekly dementia care assistant visits, the nurse practitioner, any other visits, all of those things are wrapped up in that fee. And our admin team can offer probably a lot more clarity about it. But so those are the primary requirements. And I will say for most of our patients, it is ideal if there is a primary caregiver identified, because we know as people move through this disease process, they will not be able to manage their medications, their own self-care, their living environment. And it gets really sticky when we don't have a point person to support them. It doesn't mean we don't do it. It's just, it's a good thing to have some point people involved. So yeah. I think that's it. I'm sorry if I missed anything. I will also say we have two incredible collaborating physicians, Dr. Amber Kolshretha and Theodore Johnson, who are both within the Emory system and support our team, and also staff our on-call phone, and they're awesome, and we really appreciate that they're part of our team too.
Okay, just a reminder, if you're interested in the traditional Savvy Caregiver, you can find in the chat the form to be added to the wait list to be notified as we start new cohorts, and learn more about those cohorts and sign up if you will. If you're interested in Telesavvy and you're part of the integrated memory care, you can let your provider know or let Jenny know, and she'll get you on the roster. Hoping that everyone will return next month. We'll have Katie back along with another occupational therapist, Maureen Burke, to talk about home safety in the setting of MCI and dementia. And then in October, we will have Anita here, who will be speaking, Anita Rodriguez, who will be speaking about Medicare as we approach Medicare open enrollment and trying to determine which of the Medicare products, whether it's straight Medicare and a supplement or one of the Medicare Advantage programs, is going to be the best fit for you or your loved one. And we always meet here on Wednesdays, the second Wednesday of the month at noon. If you are interested in being on the mailing list for this group, I will put my email address in the chat, and you can let me know and I will put you on the mailing list. You can take yourself off of the listserv, but unfortunately the way Emory works, I have to put you on the listserv. And that I use that listserv strictly for this MCI dementia lecture series, so you will not be getting a lot of spam. It's very well protected. You won't be getting any spam. You'll just be getting monthly notifications of this group. And with that, unless I've forgotten anything, y'all. All right. Thank you so much. Oh, one last thing. There will be a evaluation when you sign off of Zoom. There will be an evaluation form. If you don't mind filling it out, that really helps us to know what would be interesting to y'all, and also helps us with ongoing funding to be able to offer educational programs. So thank you very much.
I also just dropped into the chat our YouTube channel so that you can access our previous recordings in case you've missed some. So we're happy you joined us today, and we'll look forward to seeing you again.